have to say the field of women's health 30 years ago, frankly speaking, was dismal.
Women's health was restricted to reproductive health. That was a problem.
This was prior to NIH recognizing that females' physiology, response to medication, response to surgery, whatever, was different.
Women and people of color were being intentionally excluded from clinical trials research funded by the NIH.
And it was really incredible that the experiments were done with only male mice or male rats or male guinea pigs and never female. It didn't make a lot of sense.
SWHR made the difference.
SWHR was founded to get women involved in clinical trials at that time, and we succeeded. We took that same advocacy over to the FDA and to industry, and now women are about 50% of research participation for all new drugs that come to market each year.
SWHR has moved the agenda for women's health care forward by going to the government agencies and discussing this and lobbying for women's health care.
And so we've worked with the FDA on optimizing the regulations of drugs and devices and medical devices for women. We've also helped establish the offices of women's health throughout the federal government. And now when we look to our future, we're looking at what other policies do we need to change.
We're at a moment in our society where people are more increasingly recognizing their biases and the gaps in their knowledge. The Society for Women's Health Research can make a huge impact in the future by helping researchers and policymakers see those gaps and helping them drive needed change.
What we want SWHR to do is to strive to a point that women's health care is on the same footing as men's health care.
SWHR is making women's health mainstream by demonstrating that there's a market here. Women want new tools to treat what bothers them. We don't want pain. We want to go to work the next day. We want to be able to roll around on the floor and play with our kids. That's what matters to us. And that's what we mean about making women's health mainstream.
And I think that that's really what SWHR does the best. It catalyzes, it brings people together, and the results have been spectacular.